For joining me on yet another edition of the program You and Your Health at an Equinoxe Radio Multimedia. For presentation, I am Immaculate Fogwe. On today's edition of the program, we'll be talking about how we can better relieve gastric pain. Have you been suffering with gastritis for several years and getting solutions to your problem seems to be far-fetched? If that's the case, then sit on a chair wherever you are and take out time to get explanations from a medical expert who is going to be speaking to us on phone all the way from Bamenda. But that will be after the short break. Welcome back. On the line in Bamenda is Dr. Denis Same. He is a public health physician and he is equally the director of the Bamenda Regional Hospital. Good day, doctor. It is a pleasure having you on the program.
Thank you very much, Madam Immaculate Fogwe. I'm happy to be on this program, You and Your Health, on Equinoxe television.
Exactly. So, doctor, today we'll be focusing on gastritis. I have lots of family members, friends, and equally colleagues who are suffering with this disease. They tell you about excruciating pain that they experience on a daily basis. Tell us, what exactly is gastritis?
Thank you, Madam Immaculate Fogwe. I think I'm so happy to participate in this health program. And gastritis, the topic is a very important one of public health concern. And just to say, it has so many names. Some will call it, I have gastric. Some will call it, I have heartburn. Some will call it, gel estomac, as the francophones would call it.
Exactly.
So in short, in the public health way, gastritis is inflammation of the stomach lining. That is the brief presentation. Inflammation of the stomach lining. And when we talk about the stomach, we talk about this part of the digestive system, the digestive tract, which is just after the esophagus. And it is located in the abdomen, just below the diaphragm. So that is the stomach. The stomach is this part of the digestive system. So when the inner lining is inflamed, we talk of gastritis. Thank you.
Okay. So now, doctor, what are the symptoms of gastritis? How can I tell I'm suffering with this disease?
Thank you. How does it present, the gastritis? When we talk about inflammation, we think about things like pain. You are going to the people who have gastritis will present with upper pain at the level of the abdomen, the upper part of the abdomen, which is just which is just below the chest. In the middle part of the abdomen, this place, they will feel some pain and they will talk of burning aches. Some people will present with belching. Some will present with nausea and vomiting. Some will present with indigestion, meaning that when they're eating, they don't digest well. Some will feel as if there's some fullness of the abdomen, that the abdomen is bloated after they eat. And some people will present with no pain at all. They will have no pain, apart from some other symptoms. So that is it. Those are some of the presentation of this pain. And the characteristics of the pain is that it's some sort of burning pains, and it can radiate to the back. And it can radiate also to other parts of the abdomen. Thank you.
So now you said some would present no pain. How then can they tell they are suffering with this disease?
Yes, some people will not have pain. When I talk about inflammation, it means that it depends on the degree, not so of the inflammation. It might just be at the beginning, and this person might just be belching with no pain. And so you find him belching frequently just because that is just one of the signs. And if at all is not treated or is not diagnosed, then you find that it goes, the inflammation increases, and then pain subsequently sets in. Thank you.
And now, what are the major causes of gastritis?
Yes, what are the major causes of gastritis? Inflammation. This inflammation might be caused by infections. And the bacteria that is highly incriminated in this infection is Helicobacter pylori. This H. pylori It's actually a spiral bacterium that is usually lines in the stomach lining. And of course, if it gets pathologic, it gets infected, the lining, then the cause of this gastritis will be infection. Gastritis can also be caused by injury. You've eaten something and it has gone and then traumatized the lining of the stomach, and so you have this inflammatory reaction. It can also be caused by drug-induced gastritis. We find people who take a lot of painkillers. They take painkillers because they are having either pain on one part of the body, they are having rheumatism, especially we know our people are farmers. Aches are always aches on the joints, aches on the back, headaches, and so they are taking painkillers, especially the non-steroidal anti-inflammatories. When you take it at the long run, it is going to erode not so the lining of the stomach, and you will develop gastritis. And some may be caused by too much intake of alcohol. Alcoholic drinks are not very good when it's taken excessively above a certain threshold. It becomes a problem, and it can cause inflammation, not so, of the stomach lining. And some of the causes are smoking. Smoking too has been incriminated in gastritis. And of course, another cause may be food, the type of food we eat. If we eat too much of spicy food, we take too much of coffee, we are eating a lot of pepper, especially all the spicy food, can later on develop inflammation of the lining of the stomach. And there are other diseases, conditions too, that can predispose you to having gastritis. Just like stress, you know, you find people who are so stressed up. You see the crisis now in the northwest, southwest, people are stressed up. And so we find many people coming to consult. And I will tell you, Madam Immaculate, gastritis or peptic ulcer disease is the number 3rd consultation in the regional hospital, Bamenda.
Wow.
Many people come with, burns in the chest, burns in the abdomen. And when they undergo medical exam and diagnosis, they see that it's just gastritis. You can see what stress can do. And other diseases too, like cancers or other drugs too, that secrete a lot of acid in the stomach, can make in such a way that the stomach lining is inflamed and we develop gastritis. Thank you.
You mentioned some basic foods that could result to gastritis, like pepper, spices. So now, what type of diet should gastric patients respect? Are there specific foods they are supposed to avoid apart from the spices and let's say pepper? What type of food should they avoid at all costs?
Yes, I've talked about food, and we know that yes, when you are already known to having inflammation of the stomach, maybe it's coming frequently, we have to avoid certain foods. We know that what causes the stomach juice, the gastric juice that is used for digestion, has this hydrochloric acid. The gastric juice has this acid that participates in digestion. And so, any food that is also rich in acidic content, is going to burn the stomach lining. You know, it's going to erode the stomach lining, and so it will develop this inflammation and we can have gastritis. Some of these are some of the citrus food, some of the citrus fruits. These are fruits that have a lot of acid content. We have like oranges, we have like grapefruit, we have like this lemon or the limes that we take all the time. I think they are rich too in acid content. And you see that that's why we tell people who have gastritis to take more of fiber food and avoid lots of food that are rich in acid. Thank you.
For those who would like to participate in the program, our technician will soon be displaying the numbers on our screen so you can call and ask questions as far as gastritis is concerned. On the line, I have Dr. Denit Same. He is the director of the Bamenda Regional Hospital. And to participate in the program, you can call the following numbers: 655 511111 or 652025050. Back to you, Dr. Denit Same. Right now, I want to know, can someone suffer with gastritis carry out physical exercise?
I beg your pardon, can you repeat the question again?
Can someone suffer with gastritis carry out physical exercise?
Can you add what, please?
Physical exercise. Do sports.
Oh, yes. Okay, physical exercises.
Exactly.
Yes. When you have gastritis, I think you can do your physical exercises. Yes, actually, it's not contraindicated.
Okay.
But I think when we talk about physical exercises, which is good, but it is not really contraindicated to do physical exercises because it is concerned with the inner lining of the stomach. I know when you do physical exercises, except that you become so stressed up that you begin to secrete a lot of acid, that will be a problem. But physical exercise is very much good for those who have gastritis. You can do your physical exercises.
Okay.
But when you are in pain, you know, when you are in pain, how do you do exercises when you are in pain? So it's always good to have yourself treated and then be in good health before you do exercises, all the same.
I see. Okay, when I was much younger, I had this cousin of mine who, after eating, let's say, koki or sweet potatoes or cocoyam, she used to experience a lot of pain after being diagnosed with gastritis. Are there some certain foods, like you talked about citrus fruit, you talk about peppers, spices, so is it that they should avoid cocoyam, sweet potatoes completely, or there are other things they can depend on?
Yes, a very, very important point you've taken now. You know, if you have to talk of foods that have some acid content, we cannot avoid all of them all the same.
Exactly.
But when you are in crisis, your doctor will advise you that during this time of your crisis, because gastritis is treated, we can treat gastritis, we can manage it. But when you are in crisis, you are in that pain, I will tell you not to take lemon, not to take limes, not to take grapefruit, not to eat a lot of oily food, a lot of fatty food, not to eat a lot of fries, because it's going to increase that inflammation and you will not be treated fast. So, but when all that has been treated and you are well, you don't have any pain, you can take this food. You can take this food and mind you the quantity. But if you know that you are already a chronic case of gastritis, know that there are certain foods you have to really avoid.
You just
imagine you are taking a lot of food with lots of pepper. Thank you, Inoculate.
Yes, continue, doctor. Wait, you just talked about chronic. At what stage do we start talking about chronic gastritis?
Yes, about chronic, it means that this is somebody who has been having a repetitive series or sessions of inflammation, of gastritis, which is coming on and off. It has lasted for over a year. This person is always coming to the hospital. You know, at the clinic, the doctor sees this person. He treats the symptoms and he comes back. So this is something that is chronic. We say that this person is chronic for gastritis because for a longer period, he's been having it on, off, or he's always having the pain. So we talk of a chronic condition.
Okay, for cases where maybe the victim is suffering gastritis, but let's say the hospital is far away, what's the first aid this person is supposed to do while back at home before getting to the hospital?
Yes, talking about first aid when somebody is far away, because what we recommend is that if you have pain, you have some acute something, pain in burning pains in the abdomen like that, it's always good to consult. But before you consult, there are certain drugs which is sold over the counter which you can buy. You don't need a prescription. You can take something like antacids. Antacids are things that will reduce the acidity in the stomach. You know, you just get this antacids. I think the first aid box in the homes, we should always have things like this antacids. You have things like phospholugel. You have things like Malox. So you have that, you take it, and then that will help you. But then now you can now go for consultation. You also drink some water. You can take some milk. You know, you take some milk so that it will go, so that your stomach should not be empty. And we have also noticed that one of the causes is long-term fasting. Fasting can predispose people to developing gastritis. When you fast, it means that no food in the stomach, and so acid in the stomach goes now to, to burn the lining of the stomach, and you can develop gastritis. So I forgot about this cause. Please, fasting for too long and fasting. We know that Christians do fast. But if you start having these pains and all the symptoms of gastritis, you need to really break the fast.
And now, how long does it take to be treated with gastritis? Treated of gastritis, sorry.
How long does it treat?
Yes, how long does it take to be treated?
When you talk about the length of treatment,
yes,
I will say we can classify gastritis as acute or chronic. We have talked about acute is when it comes out suddenly. Mm-hmm. And then we can also classify them as, erosive and non-erosive type. And those who are also infective and non-infective type of gastritis. When gastritis is not infected, we take our antacid or we take a drug that will prevent the secretion of acid in the stomach. You can take this treatment, not so. You take this treatment, anti-proton form inhibitors, for some 4 to 6 weeks. If it is infected and the diagnosis of the H. pylori has been done, the doctor is going to put you on antibiotics, and it's usually in association of antibiotics, and you have to take it for at least 7 to 14 days of treatment.
Okay.
Thank you.
So now, what advice do you have for gastric patients, those on radio, those listening on radio, and those watching on TV? What can you tell them? How can they manage their condition?
Please, a bit louder, please.
What advice do you have for gastric patients listening and watching you?
Oh, the advice for gastric patients. That term gastric patient, I want to avoid it.
Okay.
Because we know in the world, we talk about already 2/3 population of the world actually do suffer from mild or some sort of gastritis.
Okay.
And so when you call somebody a gastric patient, actually maybe these are the chronic people who have all these signs and symptoms. What I would tell them is that they should follow the advice of their doctor. The doctor will give you dietary advice. He will give you an advice on the lifestyle, what you should eat when you are in pain, what you should not eat, and will tell you the first aid you can take before going for a consultation. And would advise you also don't continue to take antibiotics when they are not prescribed. Because you take antibiotics only when the gastritis has been diagnosed with an infection. So that is it. Gastritis is common, and the causes are varied. And some causes we don't even know. There are just some families that are prone to having it. So once you have gastritis, please get the advice of the doctor and then take your treatment as prescribed. Thank you.
Thank you so much, Doctor, for participating in the program. And that was Dr. Denit Same, Regional Director of the Bamenda Regional Hospital. He's equally a public health physician. That's where we end today's edition of the program, aired on Equinoxe Radio Multimedia. For presentation, I am Immaculate Fogwe, and I received technical assistance from Raphael Dipanda. Have a lovely day in the company of more programs on Equinoxe Radio and, of course, television. So long.